Hello, everyone. I just want to talk a little bit about an acronym that I use constantly to help me diagnose things, even if I don't have a good um, in mind acronym for certain disorders for symptoms. So I want to talk about vitamin C, D, E. It's super easy to remember. It's very easy to remember vitamin C from the oranges. So what this actually stands for is vascular iatrogenic, which is essentially medications or pills or street drugs, trauma, autoimmune, metabolic, and the acronym I use to remember metabolic effects is AEIOU sugar. And for this, it stands for ABG. So you're thinking CO2, you're thinking oxygen, respiration, that kind of exchange. It would include even cellular respiration, which is lactate and things like that you look for in sick patients. Electrolytes, so the big electrolytes we consider with any diagnosis is salt, so sodium. We include potassium, magnesium, things like that is what we're really looking at. And you see a lot of that on a CMP. Iron, so iron is huge. There's a lot of conditions that can change how iron is used in the body. We know we need iron for grabbing onto oxygen and carbon dioxide exchange in the hemoglobin. But also some conditions cause iron overload, including chronic conditions, chronic diseases, and hemochromatosis. So we have to consider that it can affect metabolism. And then I add on with the I for the acronym B. So I'm always thinking about B vitamins, even in the hospital and like ICU conditions, because things like alcohol affect how you absorb B vitamins. Also, things like Crohn's disease or gastro diseases that don't allow malabsorption issues can affect the Bs. And the Bs are so important for metabolism, especially when you look at cellular respiration and how that works. The B vitamins are necessary to convert your food into usable energy, and certain conditions can deplete that. The O is for ammonia. I know it says an A here, but it's ammonia, which is essentially a liver condition that causes a buildup of protein degradation products, and you can't get rid of them, and it can affect the body in severe ways. Uremia, which is essentially end-stage renal disease, or an AKI, where basically blood urea nitrogen is rising in the blood. And then sugar, which we talk a lot about in school for DKA, HHS, and conditions like that cause a lot of symptoms. So this is how you have to memorize this for metabolic. It'll help you a lot. So going back to the vitamin C, D, E acronym, we have infection, which can include anything from sepsis to pneumonia, neoplasms, so essentially tumors, a metastasis of cancer, congenital, so things that genetic conditions you could be born with, not discovered till you're an adult, degeneration, so things of aging or the breakdown of the body, and then endocrine. So let's get into how we can use this to actually help us figure out a symptom differential diagnosis. So here we go. So the first one is the example of chest pain. So on the left here, I put the vitamin C, D, E, just so that we have this to start working through it. So somebody comes in with chest pain. If you're working in, whether it's the hospital emergency room, or you're working in, say, an urgent care or even family practice, it just helps you put together a quick differential diagnosis. Now, obviously, you're gonna miss things, and you should, when you're working up a differential, obviously the things that are going to hurt and kill your patient are what take priority to rule out or at least consider. The other smaller things can be worked up in time, but here we go. So I just made a quick list of how to use this if somebody comes in with chest pain. So vascular. So right away, when we think chest pain, we're thinking heart, right? Heart, the coronaries of the heart, so we're thinking MI. Something that can be missed is aortic dissection. It feels that tearing sensation is how it's described in the chest. It can occur. So anything with that should come to mind. Right away, that helps us remember that. Iatrogenic, so we're thinking medication, street drugs, things like that. Antiarrhythmics can affect the heart, cause arrhythmias, which can cause some chest pain. We know things like with the potassium, like the Lasix, can affect, if we're not regulating sodium and potassium properly, we can develop arrhythmias, could cause chest pain. Simple things also are people swallow pills like potassium, NSAIDs. If they get stuck in the esophagus, they cause pretty severe chest pain as they break down the cells of the esophagus, muscle spasms in the esophagus. So those are things that we have to remember. Trauma. So that one's more obvious. Obviously, they've had some type of trauma, car accident, whatever the case is. Now, there are things that possibly they could have suffered later after being hit in the chest, and you would hope there would be some bruising or something to help during the physical exam to identify that if your patient is obtunded or something like that. But anything that hits the chest wall could potentially cause some issue with the lung or heart. I put in here spontaneous pneumothorax. Usually, people of younger age, it's identified people that have Marfan's, things like that. But smokers can suffer a bleb and cause basically the lung to pop, could cause some tension, pneumothorax on the heart, and cause some chest pain there. So those are some just easily identified things. So when you're thinking trauma, you're thinking lung, heart. Autoimmune, so there is lupus, RA, that can lead to pericarditis, pleuritis, which is inflammation of the lung lining, fibrosis, which is scarring, stiffening the lung, and myocarditis. Lupus can lead to myocarditis. Even RA, there are some cases of it affecting the heart itself. So that is something to put in the back of the mind as a reason for the possible heart and lung issues. Metabolic, so we're going to affect how muscle tissue of the heart is going to function. So when we're thinking about this, the ABGs should signal oxygen, CO2, which are part of the early workup in a patient. Obviously, you're going to check SpO2 and make sure they're breathing appropriately. It can also help remind us about lactate if there's a lactate issue. But you're not going to forget that if you use the acronym AEIOU, sugar, because you're going to remember ammonia as the O, so that'll help remind you. Electrolytes obviously can affect how the heart functions. Iron, hemochromatosis can affect the heart. As the iron builds up, it's very toxic to the muscle cells. With B vitamins, we're thinking more like alcohol users, things like that. Uremic syndrome, so end-stage renal disease, missing dialysis, AKI, acute kidney injury. Uremia can cause a pericarditis, which can cause chest pain. Infections, we're thinking pneumonia, the pericarditis. It can be bacterial, viral, bronchitis, so those things that affect the lungs or heart. Even myocarditis, which isn't in there, which would be can be caused even by vegetation from bacteria, things like that. So with the N, you're thinking neoplasm. You're thinking lung cancers, tumors in the chest that are putting physical pressure on things can cause chest pain. Congenital, so we have to think about things that could carry over to adulthood if we deal with the adult population, but within children, there's actually a fairly wide differential for chest pain with that. It can be everything from valve issues to aortic dissection that we see as Marfan's patients, which could occur in teens, early adulthood. Esophageal fistulas, maybe there's an abnormal connection system. Some chest pain reported ALL, thymus type stuff, things of that nature can cause congenital chest pain. Degeneration, you start to think about the spine, so thoracic, cervical spine, scoliosis. Scoliosis gets severe enough, it will put pressure on the organs of the chest. Costochondritis, I know with RA, it can cause some inflammation of the sternal area where it meets the ribs. The chondrocytes in there start to stiffen up, cause some pain. Thoracic spine injuries, maybe previously, could be decades, are worsening, causing some type of nerve impingement that could be radiating across the chest if you look at the nerves coming through the thoracic. Endocrine, so you're thinking thyroid, it can affect the heart for sure. Pheo could increase heart rate, blood pressure, things like that could cause some chest pain on the heart, worsen an existing heart issue possibly. So those are just some examples of how broad the differential diagnosis can be and how quickly with vitamin C, D, E, you can kind of go through it in your head, vascular, iatrogenic, trauma, etc., just working through it. And obviously the most important things are life-threatening things that you want to rule out first, and then the workup can take. Now some of these are zebras, meaning it's rare conditions. And I just was using this as an example to help start the thinking process. Here's another example, altered mental status. Now that's fairly common if you work in emergency room. And so here's how you can work up using the vitamin C, D, E acronym. So vascular, we're thinking CVA stuff. We're thinking epidural, subdural, subarachnoid, aneurysms, things like that can cause pressure in the brain, even hydrocephalus. Maybe there's a pseudotumor cerebri, something like that going on with the vascular system. That could be causing that. And so those are all life-threatening issues that should come right to mind. Iatrogenic in emergency departments, you're going to see this. You're going to see people coming in overdosing on benzos, opiates. Can be even a prescription med, serotonin syndromes, anti-psych drug overdoses, even simple things like a Medrol dose pack or prednisone can affect the mind, cause altered mental status, and people show up in the emergency room with that. Trauma, obvious. Any injury to the head, that's going to be fairly obvious. Maybe they suffered an injury to the head, and in the cases of subdural bleed, it's slow and they don't recognize it. If somebody says that they're altered, brings them in, and there's no sign of a head injury, the patient's unable to report that, but it should still be with altered mental status. Was there some type of trauma? And that's going to be on the top of the differential. Autoimmune, lupus, MS can cause some changes in cognition. Hashimoto's for sure, undiagnosed Hashimoto's, that thyroid isn't going to be working. It's going to affect the brain. There's some rare zebras in here, this NMDA, anti-NMDA encephalitis, where it's essentially autoimmune attacking the NMDA receptors, causing cognition issues. Metabolic for sure will cause altered mental status. So again, ABGs, are we ventilating? Are we oxygenating? How are we doing with lactate? Things like that. Electrolytes, sodium is well known for causing cognition issues, so that'll be on a CMP. The B vitamins, this iron B, that's how I remember it for the AEI, iron B, that Wernicke's. So alcoholics end up with Wernicke's, causes altered mental status from lack of B vitamins essentially, and affects the brain. Ammonia for sure. So if we have liver disease, that O for ammonia helps us remember, do we have a liver issue? Obviously you're going to get that on CMP and check those things out. And then uremic encephalitis, when uremia gets severe from whatever is going on with the kidneys, it affects the brain. And obviously the sugar, so the AEIO sugar, the AEIOU, sugars, we got to think that DKA, HHS, things like that, the sugar affects the brain. Here we go with the infection. Sepsis, meningitis, whether it's bacterial or viral, can cause cognition issues. Of course, there's zebras in there. So we're, the Creutzfeldt-Jakob stuff, which we never really see that often. I've never seen anything like that. But those are still on the differential that you can think about if you've worked up your patient and haven't got where you need, which would require an LP and obviously scanning of the brain. Neoplasm, glioblastoma, so we're talking tumors of the brain seem like more common when I had an ICU rotation. You've even seen lymphoma metastasized to the brain, breast and lung going to the brain, so anything like that. You would get that hopefully during your workup for the vascular part, you would see something in there. Congenital, so when you're talking about pediatrics, infections, CMV, rubella during the mother carrying the baby and develops an infection, passes it on to the baby, and the baby has some issues. Hydrocephalus, and like there's even zebras like Tay-Sachs, which I learned about in school, which is essentially how does the cells of the brain, the neurons and the supporting cells deal with basically cell trash, and it builds up and kills the cells. Degenerative, we're thinking Parkinson's disease. Yes, it does result in some degeneration of the brain. Alzheimer's, things like that should come to mind. Obviously, those are not life-threatening issues, but they would be on the differential for your workup for something like altered mental status. And then endocrine is huge with altered mental status. It's commonly missed by some as you're working things up. You can get led astray without doing a thyroid check. Glucose is usually caught because the CMPs run. Addison's crisis, especially if they're presenting weirdly with altered mental status, maybe they have some pericardial effusion and you're trying to figure out what is going on with the patient. So you're checking that cortisol. Maybe this is their first time that they've come to the emergency department with the altered mental, possibly to see it in family practice. I haven't seen it yet in family practice. Most of those people get worked up for their initial crisis fairly early in life, and it's usually emergency department type thing. And then obviously Cushing's disease with the excess cortisol, it's not controlled. So these are just some examples of how to use this simple acronym to help diagnose how to get your brain in a simple way to be thinking about existing conditions that you know about that could potentially be the cause of a generic symptom like chest pain or altered mental status where there's no specific known issue or in the work, especially with altered mental status. I mean, they may not be able to tell you their history. It makes the workup harder. Well, thank you very much. Hope you have a good day. If you have any questions, just leave me a comment. Appreciate it.